An allograft is a tissue or organ transplant from one person, the donor, to another person, the recipient, within the same species. Allografts are used in various medical procedures, including cartilage restoration, tendon reconstruction, and meniscus replacement. As a thought leader and innovator, JRF Ortho provides the most widely available viable cartilage solutions for allograft joint restoration to orthopedic surgeons. Their mission is to improve quality of life through innovative solutions for allograft joint restoration. Thus, JRF Ortho is redefining the standard for allograft joint restoration and maximizing the gift of donation. JRF Ortho focuses only on sports medicine, offering the largest selection of specialized, high-viability osteochondral grafts, tendons, and menisci in the industry.
So JRF Ortho specifically works within the sports medicine field. And so our distributions are that of tendons, meniscus, and those osteochondral allografts.
JRF Ortho is a nonprofit tissue bank distribution company. We work with two other tissue banks, one that's located in Centennial, Colorado, and the other one is in Dayton, Ohio. We try to supply surgeons with products for mostly sports medical type injuries.
This is an alternate option for people who've maybe sustained an injury, have repetitive cartilage damage. It gives them the ability to rebuild their joints, their soft tissues, with donated human tissue. When you register for your license, you are approached by the DMV with the option of becoming an organ, eye, and tissue donor. And so when you say yes to that and you get that little heart on your license, what that signifies is you have said yes to organs, tissue, and eye donation. And so in situations, not everyone can be an organ donor, but there are a lot of opportunities to become a tissue donor. And so we work here with our local OPO, or Organ Procurement Organization, Donor Alliance, for the recovery of donated human tissue.
So surgeons or surgical teams will reach out to us from facilities to let us know that there's a case that's coming, or maybe that there's a case that just was inputted in their system that they need something sooner than later. So I specifically work through the logistics of getting a graft to the facility. I'm the first person that the surgical team will reach out to that says, here's a case, here's the patient's images, we would like this type of graft, and we would prefer to do it on this date of surgery or a 2-week time frame. From there, I will size the patient and then find a graft in our inventory through our operations team. But then from there, it's sending the offer to the team to see if it's acceptable graft for the patient and get the graft to the facility in a timely fashion. I mean, it sounds corny, but we enjoy finding products for surgeons. We enjoy that what we do is helping people live a better day-to-day life. And it's rewarding to put in the time and effort to get things done in a timely manner. And sometimes it's hectic, sometimes it's slow. But to know that we're making a difference in people's lives is like something I think is just really remarkable about what we do as a company.
Let's hear from a surgeon who has made JRF Ortho allografts an integral part of their practice. Dr. Alex Meininger at Steamboat Orthopedic and Spine Institute is on the forefront of orthopedic surgery.
The Steamboat Orthopedic and Spine Institute is a multi-specialty orthopedic practice here in Steamboat Springs. We offer sports medicine, joint replacement, shoulder surgery, hand, foot, ankle, and spine. We've been working with JRF Ortho since 2012. They help us in terms of providing orthopedic tissue grafts for ligament reconstruction, cartilage repair, meniscus transplant. They also service practices nationwide, but they've been a reliable resource for us for over a decade. JRF Ortho helps us with soft tissue grafts like ligaments and tendons. These can be used for stabilization surgeries like anterior cruciate ligament reconstructions. They also offer cartilage and meniscus, so cartilage transplants and meniscus transplants can resurface knee joints, for instance, and help to stave off arthritis or even prolong time to knee replacement. Cartilage and meniscal tissue grafts can help us to restore joints that are damaged but not yet degenerative. So these are bridge procedures that can help younger persons restore an active lifestyle by resurfacing the knee joint, if you will, patching the bad cartilage with donated cartilage from the bone bank. There are also grafts that are applicable to the shoulder, the spine, foot, and ankle as well. Just like a fracture, the new cartilage is backed with healthy bone cells. Those bone cells integrate or incorporate into the patient or the recipient's knee just like a bone would heal in a cast. As that maturation occurs, the graft integrates and becomes populated by the person's cells. Over time, the recipient cells will creep in from the edges, populate, heal, and restore that to make it their own. Organ and tissue donation is really the miracle of life, and we're grateful for the donors. Unlike organ donation, tissue grafts can last upwards of 24 hours after death. So persons can treat upwards of 75 different people. Grafts could include corneas for visual correction, they could include heart valves. In my practice, they're exclusive to ligaments, cartilage, and meniscus.
JRF Ortho specializes in providing orthopedic surgeons with the most widely available viable cartilage solutions with over 20 years of superior clinical outcomes. Through innovation and a commitment to clinical results and positive outcomes, JRF Ortho is redefining the standard for allograft joint restoration.